Hi, it's Gabrielle Lichterman, founder of Hormonology and creator of the Hormone horoscope. So tomorrow, I have to go to my orthodontist's office because I have to schedule getting braces put on. That's right, at the ripe old age of 45, I'm going to have train tracks. It's to fix a bite problem caused by my now former dentist, but it's okay. The reason I'm telling you this is because I'm going to be going into my orthodontist office armed with a new study. Studies from the Journal of Orofacial Orthopedics. I had to write that down because I never would have remembered it. And this study shows that there's actually a specific time in a woman's menstrual cycle that's best for getting braces put on and braces tightened, and that's week 2 of your cycle. Week 2 is the week leading up to and including ovulation. And the reason for that is because rising estrogen sort of damps down pain. No, it's not going to feel like little butterfly kisses when I get my braces on in my week 2, for sure. I've had braces at 15. I remember them. I remember the pain very, very clearly. But any way I can minimize the pain, I'm going to be happy with. So I'm going to bring the study up to my orthodontist and let him know about it. Now, he's pretty keen on new research, so he may already know about this study. But the chances of him bringing up this kind of research to a female patient who's cycling is very rare. It's probably slim to none that most healthcare providers would bring up cycle-related information to their female patients. And the reason for that is because, well, we went through hundreds of years where talking about our cycles was taboo or unladylike. And then recently, talking about our cycles seemed misogynistic or sexist. It implied that we were controlled by our hormones. So many women didn't want to talk about their monthly cycles. They didn't want to talk about hormones. But now we're in a new age. We're in an age where knowing about how our hormones impact us is just practical. It just makes good sense. For instance, I want to minimize pain, so I'm going to tell my orthodontist everything I can about my cycle so that we can minimize the pain together. And this is why I want to talk to you today. I want to invite you to talk to your healthcare providers about your cycle, your nurse practitioner, general practitioners, certainly your OBGYNs are going to know everything. But I'm talking about healthcare providers who wouldn't normally bring up menstrual cycle related information, maybe because they don't know it, or maybe because they're afraid to appear misogynistic or sexist. So I'm inviting you, talk to your dentists and therapists and psychiatrists, all your whole healthcare team. If you feel that you have a cycle-related issue or you have a health problem that's impacted by your hormones, talk about it. Or ask, is there a way that I can make my issue better by somehow syncing it with my cycle? They may know and just needed that little prodding to get it out of them, so they felt comfortable talking about it too. I really feel like together we can make talking about hormones normal. We could just normalize it. I mean, after all, it's just practical know-how. The other thing I want to tell you is that I'm going to be walking into my orthodontist's office with my Hormone Horoscope Pro app because I have to schedule putting on these stupid braces. I want to make sure that I pick the right day in my cycle. And in the Pro app, you can see weeks and months ahead where you are in your cycle. But of course, I do want you to download the Pro app. That would be great. But you can also, of course, go old school and just use a regular calendar and, write in your cycle days and keep track of it that way if you need to sync up something with your cycle. So, to sum, when you are talking with a healthcare provider, please, if you have a cycle-related issue, talk about it. If you think that something could be helped by syncing it with your cycle, ask about it. Let's make talking about hormones and menstrual cycles normal. Okay, so please visit my website, hormonehoroscope.com, to learn more about how your hormones impact your health, behavior, moods, energy, and everything else. And, of course, download my Hormone Horoscope Menstrual Cycle Tracker app. There's a free version, of course, too. And I look forward to seeing you again soon.